Alright, picture this. You're 10 days away from NEET-PG exam and you're starting with your final revision. You have your main notes and you've read them and they're well highlighted too. But now you think, how will I revise all of this in just 10 days? You get anxious, you get scared, you panic. Should I read this? Should I skip this? Should I just throw all of my books away? If that sounds relatable, then you're missing on the one most important thing that you can do that can boost your NEET score and also reduce your anxiety. And that is making concise notes. So in this video, I'm going to tell you exactly how I did it, get into the details, and also show you some of my notes. I'll also show some examples from two of my friends, Tanvi and Harsh, who have scored All India ranks 1200 and 179. I'll also be taking the interview soon, so stay tuned for it and subscribe to the channel so that you don't miss it. Let's not waste any time and get right to it. So first thing, let's talk about why should you even make concise notes. So this is because the notes that you make the first time while doing classes or lectures are for your understanding, and so in those notes you write full forms, full sentences and all, and so those notes are very big. But as you study and move ahead, you get familiar with many of the abbreviations and many of your concepts get cleared, and so there's no need to write any of them in full. So you can shrink your notes by a lot and they can become small enough for you to read even towards the end in a few days. So I'll give an example. In my ENT notes, the year section was around 40 pages in my notes, but by concising it, I reduced it down to 15 pages. True story. Now let us talk about some principles that you need to know before you start to make your notes concise. The first principle that you need to know is that don't use someone else's concise notes. They may not work for you since they have made it according to their own understanding and their own weak points. Make the notes your own, personalized. These notes are better to remember and recall. You can make a separate notebook, write it out on small sheets of paper or make sticky notes, whatever suits your style. The second principle is you have to finish at least one read of your main notes before you start to make concise notes. This is because you at least need to have a bit of understanding of your notes and the content before you know how to concise the notes, because you need to know what is important and what is not. The third principle is know the exam. So if you've seen Suits, you must be familiar with Harvey Specter's quote, "Don't play the odds, play the man."
I don't play the odds, I play the man.
Well, I have a similar quote like that. Don't play the odds, play the exam. So know what is important in the exam that you want to give. For example, INI-CET asks more of genetics oriented stuff, and that's why you add those things to your notes from INI-CET. But for NEET, you won't add any of those. So your INI-CET and your NEET concise notes are going to be different. The fourth principle is that coaching classes notes are already very concise. So for the topics and the subjects that are already given to you in a very concise manner, you need not waste any more time to make them more concise. Just read them as it is. And the fifth principle is to use grand tests as a guide for making your notes concise. So the questions that you're frequently getting right in grand tests, you already know it. No need to add it to your concise notes. But the questions that you're getting wrong, those are the questions that you add to your concise notes. For example, I used to get the heparin-induced thrombocytopenia question wrong very frequently, and so I wrote it down in my notes point-wise with the points that I used to get wrong frequently first. Now let us move to the specific tips and techniques that you can follow to concise down your notes. So the first thing I'm going to tell you here is the 3-pronged strategy for making your notes concise. Let us take an example. So in forensic medicine, there's a topic of tests to detect semen. Let's see what the 3-pronged strategy is. The first thing is to identify what is important and write only the important things. So in this particular case, what is important is that what are the tests and then what time are they done up to and what do you detect in these tests. So I have written only those specific things over here. The second principle in this is to keep things organized. So for example, in this case, what the test detects, I've written on the left side of the page for both of the tests. So like here, the Barberio test detects spermine and the Florence test detects choline. So I've written both of them on the left side. So while I'm reading this, now I can just quickly skim through and I know on the left side, I have got what is detected in those particular tests. And the third thing is to mention the content with which it can be confused. So for example, here these are tests to detect semen, but there are also tests to detect blood. So I've written the test for blood down here, that is the Takayama and the Teekman test. So I see them at a glance and I know I shouldn't get confused. So this strategy can be used for many topics and it can make your notes concise while including all of the important information. The next step is to make flowcharts, tables and diagrams. So an example of charts is the chart that I made for the bacteria and microbiology. So here I've noted down the gram-positive and the gram-negative bacteria, and not just that, the further subclassification, the specific bacteria in the particular class and their characteristics as well. As you can see over here, for example, for Bacillus, I've noted down all the characteristics in very few words, in very limited words, such that only the important stuff is included. So this chart has a lots of information on this one single page and it reduces anxiety because for bacteria, you have to do only this one page and most of your content will be done. So my friend Tanvi, who I mentioned earlier, also made a similar chart in microbiology for enterobacteria. The next example of a flowchart is the flowchart I made here for heme synthesis and porphyrias. So this might look really messy to you, but it all makes sense to me. And that is because I have made it myself. So since I've made it myself, I know what I've written where and I can read this really quickly. You know how they ask messy people about how they find their stuff in the room, but they say that they can find it because it is their mess? Yeah, this is something like that. Another great example of tables is the table I made for urology from surgery. So after reading surgery and doing the questions, I observed that they ask questions from very specific points like what is the investigation or what is the treatment. And so I made the table including only those important points over here in a glance. But this becomes really concise and you can very quickly revise urology from these notes. Now my friend Harsh, who got an All India rank of 179 in NEET-PG, also made similar tables and charts. Here's the table he made for the final management in obstetrics. In obstetrics and gynecology, they ask you only the final management of things mostly, not the very specific details of the other things in general. So Harsh made tables only including the management of these conditions. And so as you can see, it is just 6 pages, and just within 6 pages, the majority of the important stuff in Ops and Gynae is done. And here I'd like to make an honorable mention of the insane diagram that I made for metal poisons in forensic medicine. So in my original notes, metal poisons in forensic medicine were distributed in around 2 pages, but I concised it all down to this single chart in one single page. It took quite a lot of time to make, but it was all worth it because as you can see, this single page covers most of the important stuff about metal poisons. The third tip is to include only keywords and exclude all unnecessary content. Now, how would you know what to include and what to exclude? You'll have to have done one read of the topics and you have to give grand tests and previous year questions. I'll show you a good example over here. I have concised down amino acid metabolism and disorders notes. And if you have done previous year questions, you would know that amino acid metabolism is a very high yielding topic for NEET-PG. So I'll compare my original notes with the concise notes here. So here in my original notes, as you can see, within methionine, there's the whole pathway of methionine to cysteine, how it happens. And in the middle, it is shown that the methyl group is transferred to norepinephrine to form epinephrine and to serotonin to form melatonin. And down there, we have written that same thing here, that is SAM is methyl donor. And while writing the notes, ma'am had told us that this is a question. Was it ma'am or sir? Anyway, so this was told to be an important question, and so I wrote only that thing down here in my concise notes. SAM is a methyl donor, and I simply wrote the norepinephrine to epinephrine and serotonin to melatonin, and that too in short form right in front of it. Then I jump right to the treatment of hyperhomocystinemia, because as you keep reading, you know what hyperhomocystinemia is. You know that there's intranasal lens dislocation and increased coagulability in this condition, and that is why it increases the risk of cardiovascular disease. So since I know all of this, I'm not putting all of that in the notes. What is important is the treatment of it. What vitamins are used to treat hyperhomocystinemia, that is B6, B12 and folic acid. So that's the only thing that I've written here. So I've skipped all of this portion over here about homocysteine transferring sulfur to LDL, and then even about cystinuria, as you can see over here, I've included only these two facts, that it has rotten eggs odor and cola are excreted. I know what cola is because I've read it many times, even in nephrology. So I've not mentioned the full form of it. And then finally I mentioned that methionine malabsorption causes dear baby syndrome. So around 2 pages of content over here, I've concised it down into just a few lines in my concise notes. One more important and high yielding topic from biochemistry for NEET-PG is collagen and its modifications. So I've also concised all of that down here. In this starting point, I've only mentioned that collagen is glycine XY repeats and X and Y can be proline and hydroxyproline, that's it. Then I move straight to the post-translational modifications. Now here within intracellular, I've mentioned only hydroxylation and glycosylation. Now if you look at my original notes, below hydroxylation, I've also mentioned the reactions, proline to hydroxyproline and lysine to hydroxylysine. But that is obvious, isn't it? That is what we have mentioned in the title. So I've excluded that and I only included the name hydroxylation. And I've highlighted the starting words of both of those. So all the important points about collagen metabolism and modifications are finished in just a few lines. Now Tanvi also made similar charts excluding unnecessary content and including only the keywords. Like for example, this chart that she made for biochemistry, which has gluconeogenesis, glycogenesis, HMP shunt, fatty acid synthesis and ketogenesis, all the key points included on one single small page. She's done the same for surgery over here, like IHPS, infantile hypertrophic pyloric stenosis, just the 2 key points there, then gastritis, Menetrius disease, only the key points included on one single small page. Now the fourth tip is to remove unnecessary words and phrases. Now this might sound similar to the last tip, but it's a little different. Let me explain. So here we'll take the example of anatomy. In the thorax section, I've written about intercostal arteries. So here while I was doing the lecture, sir had told us to write complete statements, and so I've written complete statements in my main notes. Within anterior intercostal arteries, I've written that in the upper 6 spaces, there are branches of internal thoracic artery. In the lower spaces, there are branches of musculophrenic artery. There are total 2 anterior intercostal arteries in each space, and 9 intercostal spaces will have anterior intercostal arteries. So here I've written complete sentences. Now let's take a look at my concise notes. In here, I've simply written the title anterior intercostal arteries. Immediately in front of it, I've written that they are in 9 IC spaces. No need to write the full form of it. 2 in each space. Then upper 6 internal thoracic artery and 7 to 9 musculophrenic artery. That's it. So here I have not excluded any information, but I've just removed unnecessary words and phrases that was making it long in my main notes. So even by doing something as simple as that, you can make your notes really short and really quick to read. Another good example is in biochemistry in the protein separation techniques. So in my main notes here, I've written it very long, over a span of I think here 2 pages. And within each of them, I've written the words principle and then based on charge of protein. For example here, SDS page is based on electron, mass of protein. Anyway, I have skipped all of those unnecessary words in my concise notes here. I've simply written 3 bold headings which tell me at a glance what those 3 main types are. Then within electrophoresis, I've written headings of the subtype and only what it is based on. Native gel or agarose gel charge, SDS page, mass, ion exchange charge. And in this way, 2-3 pages of content got concised into one single page. Here, one little added advantage of iPad is that I can also add images. I added these images from Marrow Cubanks. Now the 5th tip is very important. It is to write similar looking topics together. The prime example here in my case is interstitial cystitis versus malakoplakia. God, this thing haunted me for so long. I used to consistently get this question wrong in multiple GTs. That's not the kind of consistency you want, by the way. So later, at one time, I decided that I would just include both of these things on one single page and included only the differentiating points here. And here I also highlighted the differentiating points. In interstitial cystitis, you see glomerulations and Hunner's ulcers, and in malakoplakia, you see von Hansmann cells and Michaelis-Guttman bodies. So now when I'm reading these concise notes, at a glance I see what is the difference between the two, and I'm now less likely to get it wrong. And by the way, I didn't get it wrong again in any other grand test. Another example here can be found in microbiology. Now there are 2 tests in microbio in bacteriology, which are CAMP test and reverse CAMP test. Now the CAMP test is for streptococci and the reverse CAMP test is for Clostridium perfringens. And both these bacteria are taught separately and they are separated by many pages. But both of these test name is similar and they sound confusing. So here it becomes very clear that in the CAMP test, the bacteria that you want to test for is streaked perpendicular to the central streak, which is of Staphylococcus aureus. Whereas in reverse CAMP test for Clostridium perfringens, the Clostridium perfringens, that is the organism you want to test itself, is streaked in the center with Streptococcus in the perpendicular. It's actually not a very big difference between these, but this question can be asked based on the wording, that is CAMP and reverse CAMP. Now these are all examples of similar sounding stuff in the same subject. When you have read sufficiently enough, you'll also be able to bring similar sounding words from different subjects into one place. And this is what Tanvi had attempted to do. Like here you can see she has written down Hutchinson fracture, Hutchinson's teeth and Hutchinson's sign in one line. The next step here is to group things in relatable or logical chunks. Now here I have an example from PSM. In PSM there's something called Intensified Mission Indradhanush, which is a different vaccination program compared to the National Immunization Schedule. So what vaccines are included or not included in Mission Indradhanush was a previously asked question. So here in the diseases covered, I have grouped them into chunks. So the first 3 that you can see here, TB, polio and Hep B, are basically constituents of the NIS as well, in the form of BCG, OPV and Hep B vaccines. So these 3 are chunked in the beginning. Then the next 3 are diphtheria, pertussis and tetanus, which can be chunked into DPT. Then we have measles and rubella, which are MR. Then the 10th one here is H influenza type B, which is a part of pentavalent vaccine itself. And so in a sense, the only 3 new vaccines that are there in the intensified mission in the Dhanush are the rotavirus vaccine, the pneumococcal meningitis vaccine and the Japanese encephalitis. So I've highlighted only these 3 vaccines here. So the rest of the diseases you can remember in chunks, and that will be it. Another example of this is the IPC sections in forensic medicine. So before remembering what each section is for, remember what the ranges of sections are for. So for example, the IPC sections 191 to 201 are for evidences, 87 to 92 are I think for consent, 319 to 326 deal with hurt. I hope I'm remembering them correctly. Now even the specific IPC sections can be made slightly easier to remember using the next step, that is to use short forms. So here for example, I have written down the IPC sections related to hurt, 319 to 335. So here as you can see, I have abbreviated grievous hurt as GH and dangerous weapon as DW. So I've used these abbreviations instead of those words there. I've done the same thing for homicide IPC sections. Culpable homicide has been abbreviated as CH, not amounting to has been abbreviated to N/A/T. And so this way I can quickly skim through these while I'm doing my last revision. Let me show you another example of using short forms. So here within colorectal polyps topic, we have variants of FAP. FAP is familial adenomatous polyposis. So there are 2 variants here, that is Gardner syndrome and Turcot syndrome, and within Gardner syndrome we have CHRPE. It is congenital hypertrophy of the retinal pigment epithelium. Now in my original notes I have written the full form of this thing, because of course when you're studying it for the first time you don't know what this is, and even if you have done 1 or 2 reads or 3 reads you still might not remember this, but after having done 2 or 3 revisions you know what CHRPE is, and so in your concise notes you do not need to include the whole full form, you can simply write CHRPE. The next step is to make your own tricks. An example here of how I did it was with the tumor suppressor gene chromosomes in pathology. Here I've made the trick of what tumor suppressor gene is located on what chromosome. Like for VHL is located on chromosome 3. So I read about VHL and all the syndromes associated with it, and I found a pattern that it is associated with all the 3-letter stuff. So basically the mutation in VHL causes increased amounts of HIF, that is hypoxia inducible factor. That leads to increase in the amount of RBCs, that also increases VEGF or VGF, and that is what leads to hemangiomas. And one of the things that is seen in VHL is RCC, renal cell carcinoma, and within renal cell carcinoma the most common paraneoplastic syndrome is raised ESR. So many different facts got included on this one page in a very few lines, because I tried to make a trick and correlate all of these together. The next step, which is very specific for NEET-PG, is to write SSCs separately. SSCs is staging, scorings and classification of criteria. Now these are relatively more important for NEET-PG than INI-CT. NEET-PG people have been known to ask about criterias or stagings. And that's pretty much it. Now go make your notes concise. Reading the huge syllabus of MBBS is tough, but what is tougher is remembering all of it. But you can make it much more easier by using flashcards. If you want to know how, check this video that I made about it. I hope you found this video helpful. If you have any suggestions or queries, drop them down in the comment section below. And I'll see you again in the next video. Bye.